The most common cause of problems, litigation, lawsuits, whatever you want to call it, depending on who you are, is leg length problems. And in my opinion, it's almost always female patients that have the problem. And the reason why there is a leg length discrepancy is because when you do the surgery, you do your very best to make the legs the same length. The hip, one of the ways to stabilize the hips is you have these big tendons called your abductor tendons, and they keep the hip from dislocating. When you cut the neck out, you cut out some of the important stabilizing structures of the hip. It doesn't matter if you go from the front or the back, what approach you take, you will destabilize the hip in one position or the other. If you do an anterior approach, the hip is less stable from the front. If you do a posterior approach, it's less stable from the back. But the short idea of it is to make the hip more stable, sometimes you have to lengthen the leg a little bit to put more tension on the abductor tendons to keep the hip stable, to reduce the risk of dislocation. So, back to why women have more problems than men. Well, when you have a small leg length discrepancy, we're talking about millimeters here. The easiest way to accommodate that and not feel it is to stand like this, which most men do anyways. Most men don't stand like this. Females stand like this, and if you have a tiny little leg length discrepancy, you feel like you're going to fall over. And so I could tell my female patients that feel that you can stand like this, but that won't happen. So